Good morning and good afternoon, everyone. I'm Jamie Parrott, Vice President and Chief Operating Officer at MedResults Network, and I'm delighted to welcome you to our very first educational webinar presentation for 2019. And since we're just kicking off our 11th year in business, I feel that it's appropriate that I give a little background about MedResults to either familiarize you if you're new or refamiliarize many of you with our network. It's hard to believe that just over 10 years ago, MedResults started with only 30 medical spa members, all of which had one key need in common, which was to find a way to reduce costs and stay afloat during the down economy in 2008. So through what started as two small partnerships with Medicis, and for those of you who don't remember Medicis, they originally distributed the Dermal line of injectables, and Obagi, who at the time was the leader in medical grade cosmeceuticals, we were able to offer what became the very first aesthetic medical loyalty programs to the industry. And over the years, with the support of our partners and member benefits that predated today's injectable and skincare loyalty programs, we grew very quickly into just about every type of aesthetic medical business, including plastic surgery, dermatology, and now, of course, a variety of non-core professions. Today, we have nearly 50 aesthetic contracts, all of which afford our members discounts, rebates, or a combination of benefits. And we've also grown to roughly 3,100 members nationwide with more than 5,000 doctors represented in the network. And our constituents consist of more than 750 plastic, cosmetic, and facial plastic surgeons, 400 dermatology practices, and that's represented by over 1,000 dermatologists, another 1,400 medical spas, and of course over 500 non-core medical providers who now offer aesthetic treatment. So it's been pretty exciting to work with such a diverse group of individuals in this, this ever-growing industry. With that said, although we feel like we've seen it all in terms of new products and procedures and technologies, every year changes so frequently that it's likely we've only touched the tip of the iceberg, which is why we continue to find new partners and programs that can add major value to our members. So that's really our goal here at MedResults is to continue to try and provide unique services and products to you guys to help your business in the future. In 2018, last year, we developed a number of amazing new relationships with groups like Sientra for Biocornium, Eclaris for Escada, the Medical Business Academy, among others, and of course, Suneva for Bellafill, who's actually here with us today. We're delighted that after a decade of ups and downs and major industry changes, that we can still offer opportunities for aesthetic medical providers to gain access to free and on-demand education. Brian or Andy, I think there's some feedback. If one of you wants to turn off your microphone. I'll just wait for a second. Okay, perfect. I can get back into it. Thank you. Anyway, as I was saying, it's just exciting that we can still provide these opportunities in terms of education and cost savings on the products and services that you guys are all using regularly. So thank you to all of you for your continued membership and support over the years. Now, to the reason you're all here with us today, we are thrilled to welcome two very intelligent gentlemen from Suneva to educate us on the dermal filler market and what's fueling major growth in this space. Today, we have Andy Boutom, who has over 15 years of experience with marketing consumer healthcare products for major global companies like Johnson & Johnson, Merz Aesthetics, who's another partner of ours, and Zeltique. And after acting as the global marketing director for Radius and Bellatero, he led the international launch of Cool Sculpting worldwide. Andy is currently the head of global marketing and international business development for Suneva Medical. And Dr. Brian Pilcher, our second speaker for today, received his PhD in cell and molecular biology from the University of Oklahoma College of Medicine. And he performed his postgraduate training in dermatology at Washington University in St. Louis. Dr. Pilcher spent the last 15 years in the pharmaceutical and medical device industries, leading medical affairs teams at both Bioform Medical and afterwards at Merz Pharmaceuticals. And he currently heads Critical Mass Medical Affairs and Scientific Strategy Consultants, which is a company focused on delivering incremental value to companies by setting medical and scientific strategy with commercially driven focus. So he's currently consulting with Suneva and Medical Affairs to date. Before we begin, I want to let you all know that while we don't have a live Q&A at the end of the presentation, we do encourage you to ask questions of our presenters, and we'll get to them at the close of the webinar. And you can do that by typing in your questions in the webinar chat box. Also, if you prefer to ask a question privately, you may do so in our short survey, which will pop up automatically after the presentation closes. So please remember to take 30 seconds to fill this out, as it also provides valuable feedback for us at MedResults and our partners. So without further ado, I would like to introduce our first speaker, Andy Bouton.
Thank you, Jamie, and good morning to everybody. We are really excited here at Suneva to be partnering with MRN because we feel like these customers and your customers within the MRN network can really benefit from what we can provide as a product within the overall practice offering. And what I'd like to do today is start by having a conversation specifically around Bellafill and how Bellafill is beginning to address the top consumer demand in the filler market space today. So what I'd like to do is move you to the next slide, where we are going to be talking about how dermal fillers have become mainstream. From an injectable perspective, it has really driven the aesthetic marketplace and brought it to an increase of 5.1% year over year, which for the first time, I believe in 2016, the numbers that came through from ASAPs brought the total aesthetic marketplace to be valued at over $16 billion, which is pretty significant. And again, a lot of that is being driven by the injectable segment of that marketplace. And what we saw over the past 5 years is injectables actually saw a 40+% increase year over year in growth. And that's what we really mean when we say dermal fillers have become more mainstream, where consumers and patients alike are now beginning to ask for specific products, dermal filler products by name, where I'm sure some of you may have experienced in the past some patients thinking that Botox and fillers were one and the same. But now we're seeing that consumers are beginning to be a lot more educated and understand the differences between these two products and what injectables can do for them for their anti-aging needs. A lot of the what's driving this the dermal fillers to become more mainstream and injectables becoming more of a key player in the aesthetic marketplace really is around these social trends that we're seeing. I like to break it down to kind of 3 different buckets of social trends. One is, obviously being the first is the selfie phenomenon, where today everybody's taking pictures on their these beautiful new smartphones that they have with these wonderful cameras. And as a result, it's causing people to be a lot more critical of how they look on camera. And it's highlighting certain things like how they're aging. And so they're beginning to see that a lot faster and recognize it a lot faster than they normally would have, which is really driving them more into aesthetic practices to seek out solutions for some of their aging issues. The second really is around this idea of celebrity sharing. And I bring this example up of, even 10 years ago, when you talk to celebrities about getting treatments, aesthetic treatments, a lot of them would actually deny the fact that they actually had these treatments, even though it was very clear to all of us in the industry that they have, taken Botox or had some other filler type treatments, but they just weren't really talking about it as openly. But today, they're actually very open about it. Many celebrities actually have partnered with some aesthetic products within the industry and have been very open about sharing their experiences with patients and consumers, which then makes it a lot more socially acceptable. We're also seeing, incidentally, 64% of consumers out there actually saying that aesthetic procedures are now more socially acceptable and they're more willing to talk about it in general as a result of all of this that's happening around us. And the third really is around what I call the prejuvenation market. And what we're seeing is a younger set of patients are coming into the injectable marketplace, and they're being introduced to first and foremost toxins, and namely, Botox as the #1 kind of brand recognized brand within the toxin market. And from the start of where we started tracking this in 1998, there's a significant jump and increase in patients between the ages of 19 to 34-year-olds coming into the marketplace, seeking out treatments with toxins. We also know, though, that these patients become a great pipeline for future filler users, because approximately 25 to 30% of those patients that are toxin patients will eventually become filler patients in any given aesthetic practice. So for us, for having Bellafill, which is a 5-year filler, what we really wanted to understand is what are the current patient needs. Some of you may have heard about Bellafill years ago when it got approved back in the mid to late 90s, along with a slew of other dermal fillers like Juvederm, Restylane, and Radiesse. The unfortunate thing is I really do believe that this Bellafill has been a product before its time. Because what happened 10 years ago was, as people were just stepping into the filler marketplace, patients and consumers were just beginning to understand and experiment with fillers. And you may recall, even back in those days, we were all line chasing versus looking at total kind of facial aesthetics and providing volume as a way to treat aging patients. And so patients and providers back in the day were trained to look at specific lines and inject 1 or 2 syringes, versus where we are today, where we're looking at the face as a total, as a global aesthetic assessment to the face, which then resulted in more product being used, but also more volume being put back into the patient's face. Now, fast forward 10 years later, where we are today, patients are really beginning to feel what we call filler fatigue, which is this idea of having spent a lot of time with getting needle sticks for filler injections, as well as paying for it, as well as the time it takes for appointments. And so what we've done is we commissioned the Harris Poll survey to help us understand really what consumers are looking for. And the next few slides will walk you through why we feel Bellafill is actually a great product offering for your patients at this point in time. From a total population perspective, and this I know is a little bit of an eye chart, but I do want to walk you through kind of how we came up with these numbers through our Harris Poll survey, which is an independent validated market research company that's helped us really pull in these consumers and understand what they're thinking and what their demands are. So in total, in the US, for filler patients between the ages of 30 to 65, we are seeing that there are about 9 million filler patients out there today who've had filler usages at some point in their lifetime in the past. What's really interesting to us is that the split between men and women is almost 50-50, which is something that we have seen really transform over time, because it used to be that it was primarily women in this marketplace, but now men are becoming more and more aware of and asking for fillers as well. Now, when we ask these consumers, the 9 million patients that we spoke to, we describe to them what filler fatigue means. And again, filler fatigue for us is defined as patients who are feeling tired of having to come back for multiple injections in a short amount of time. Patients who are tired of having to put the money out for their frequent filler injections, and patients who are tired of having to put out the time to come into your practices because they're all really busy these days. The total number of patients who are experiencing filler fatigue at some level is about 8 million of the 9 million filler patients out there. Now, when we asked them if they were interested in a long-lasting filler That number goes to 6 million of those 9 million filler patients who are now interested in a longer lasting filler. The next question that we asked is, what if there was an FDA approved 5-year filler? How interested would you be in that? And that number pops back up to 8 million. So remember, the difference between a patient thinking about a longer lasting filler versus a 5-year filler is that when we say longer lasting filler today, they're thinking about 2 years, which is something that Juvederm Voluma has really kind of pushed out into the marketplace to help create that awareness for consumers. But they still don't understand or are aware that there is a 5-year filler out there. And when they hear that, that total population of people who are interested in a 5-year filler pops back up to 8 million. We also are looking at, as you may recall, the split of that 9 million is almost 50-50, that men become a major part of our marketing opportunity with Bellafill and your opportunity as an aesthetic provider. The reason why we want to help you also attract male targets using Bellafill is that, as you see, aesthetic procedures with men is expected to grow by close to 11% year over year annually. And injectables continues to be one of the top 10 most requested procedures. The other interesting thing about men that we think is specific to Bellafill, or that Bellafill can address, is that men are looking for what we call effective and low maintenance treatments, meaning they don't like coming in time and time again for treatments. They just want something that they can get done and not necessarily have to think about it, but experience and enjoy the results that they get. In addition to that, for any given brand or service, men are super loyal, meaning they're not going to be shopping around or price shopping per se. If they get a really good treatment with at an aesthetic practice with a product that they really like, chances are they will stay with that provider. So I'm going to walk you through just some highlights and a little bit more detail on the Harris Poll survey. So again, we said 9 out of 10 filler users are interested in this 5-year filler. That's about 90%, a 90% interest level. What we also are finding, which I think is very interesting, is younger filler users are more likely than their older counterparts to be interested. 92% versus 84%. And if you really break it down, what we're beginning to see is if you think about that prejuvenation market segment, as these younger patients and millennials are coming into the aesthetic marketplace, they're now having to look at a lifetime of spend on fillers. And so the value behind a 5-year filler is much greater and of much more interest to this particular younger segment of the population. From a switching perspective, we asked the question of whether or not patients would be willing to switch their current provider to get a 5-year filler. And it was actually very surprising to us, because the kind of old belief was that while patients were very fluid when it came to toxins, meaning they would be willing to go to any provider for a toxin, and they were most likely price shopping, when it came to dermal fillers, because of the art and science behind it and the kind of injection skill that it takes, most patients were less willing to switch providers, except when it comes to the idea of getting a 5-year filler. And so this longevity for Bellafill is really compelling to patients, so much so that 82% of them have said that they would be likely to switch their current provider to go to another provider that offers Bellafill. So what that means for our providers is that not only are you driving loyalty with your patients by maintaining them in your practice with a 5-year filler, you're also given the opportunity to attract new patients to your practice because of that interest and that demand in a long-lasting filler like ours. The last question, or one of the last questions that we asked, because what we're seeing and what we've heard from our providers is that while they can see the benefit and the value proposition for patients, what they're afraid of, quite honestly, is the loss of the ongoing annuity business of a short-acting filler. And so we felt that we owed it to ourselves and to our partner providers to really understand what is happening with consumers and the practices once they've gotten a 5-year filler like Bellafill. And what the question that we asked is, with all the money that you'd be saving on a 5-year filler, would you necessarily take that money and spend it somewhere else? Or what would you actually do with that money? And what we saw was 88% of those patients would actually take the money that they saved they would save by having a Bellafill treatment, and they would turn around and take that money and actually explore other treatments and cosmetic treatments within the practice. So what they're telling us is essentially they've been handcuffed by their fillers, and while there's so many other items or treatment options within your aesthetic practice that they would want, they were still handcuffed by fillers. So now when you remove those handcuffs and you allow them to get the value of a 5-year filler, that money that they would have spent on regular filler treatments is now being spent on other treatment modalities within your practice. And we asked them what were their top things that they would like to have in terms of cosmetic treatments beyond fillers. What they reported to us was skin rejuvenation, laser hair removal, fillers on more areas of the face, so that they'd actually explore other areas on their face, as well as body contouring, a procedure like cool sculpting. Okay, so at the end of it, the net of what we're seeing is Bellafill actually helps you get new patients by attracting new patients to your practice, but also grow your practice beyond just fillers as well. What I wanted to also do here is talk to you real quickly, now that we understand what consumers are asking for, an understanding of how we as a company partner with our practices to ensure that you are successful with Bellafill. And where it all starts is what we call our Suneva steps for success. So with any new account or any new partner that signs up with Bellafill, what we start with is we provide clinical training and education to ensure that you are super comfortable, and any injector in your practice is really comfortable in understanding how Bellafill is used and injected with your patients to ensure that you've got great clinical outcomes for your patients. The second is really helping you build internal brand advocates, meaning we will provide free kits for you and your staff members so that they can really experience what Bellafill is like and can have that real personal experience that they can speak to your patients about to help you promote Bellafill. And the third and fourth steps are really around marketing and practice development and enhancement, where we will come in and help you devise a program to ensure that your practice is running at its best and max capacity in terms of helping you optimize your front desk, as well as how to build a really great consultation session with your patients around Bellafill. And then with practice marketing, we offer a number of marketing materials and customizable marketing materials that will help you really drive Bellafill usage and patients to your practice. What I also wanted to do is walk you through real quickly just some highlights of our marketing strategy and how we're actually generating consumer demand off of this Harris Poll survey. And what you've seen is we have launched 2 new consumer campaigns within the last year. One to really focus on our cosmetic side of the business with Bellafill, but as you may or may not know, we also have an acne scar indication for Bellafill as well. And so we've developed 2 major consumer campaigns that really speak to consumers on both of those indications and provides them with a really great reason for why they should choose Bellafill. And when they've seen these campaigns, what we're finding in our market research is 9 out of 10 patients had positive purchase intent, meaning that after seeing the campaign, they really wanted to reach out and find a provider to get Bellafill. In addition to that, we have partnered with major consumer publications like New Beauty, where we've hit over 2 million consumer impressions through advertorials and major New Beauty features. And then we've embarked also on a major public relations and digital and social media marketing campaign. And as of today, we've hit over 700 million consumers via TV appearances, national print, and targeted digital campaigns throughout the country. What I'd like to do is actually close out the marketing portion of marketing opportunity discussion with a preview of what our 30-second ad spot looks like for Bellafill. And this is what you will start seeing, not necessarily on TV. Again, we're focused on our digital efforts. And so we're pushing this through all of our digital display ads on Google, as well as through YouTube. And so far, we've gotten over 1 million impressions with this particular 30-second TV spot. Jamie, can you hear the TV spot, or is it just coming through as blank right now?
Unfortunately, I can't do it.
Okay. Well, we will. What we could do is we can follow up and provide a link to our YouTube channel with everybody on this call, so that you can see this campaign and with the content behind it. Okay. With that said, thank you very much for letting me speak about the marketing opportunity. I'm going to pass it off to Dr. Brian Pilcher to talk about the science behind Bellafill.
Thanks, Andy. I appreciate it. So what I'm going to do is spend the next 15 or 20 minutes talking about two specific topics as it relates to Bellafill as a dermal filler. The first is its mechanism of action, and then we're going to spend a little bit of time discussing its safety in the marketplace. As Andy mentioned, this product has been on the market having approval for both the nasolabial fold and for distensible rolling acne scars for a number of years, now approaching 12 years on the market. And there's a rich history of post-market surveillance data that's been collected as part of that effort, and Suneva has been willing, as part of this endeavor, to make sure that providers understand the safety of this product in comparison to some of the misperceptions that may be out there. Now, Bellafill fits into dermal filler category as being a biostimulator. And what I mean by that is when you inject this product, which is made up of 20% volume polymethyl methacrylate microspheres suspended in a bovine collagen gel carrier, the collagen making up 80% of the total volume. When you initially inject this product, the volume that's injected is the correction that you see. Now, what happens over time, and in contrast to, let's say, a space-filling dermal filler, such as hyaluronic acids, that go away very slowly over time, usually between 4 and 6 months after they've been injected, Bellafill acts like a biostimulator in a very similar manner to another product that's on the market, as we all know, is Radiesse, in that the microspheres will that are injected stimulate the patient's own collagen to be produced, which provide for that longer-lasting correction. So where we know we get about a year of correction or more with Radiesse, studies have shown that Bellafill gives up to 5 years of correction when injected into the nasolabial fold. So the way to think about Bellafill is more of a long-lasting biostimulatory type of filler, causing the patient's own collagen to be produced. Interestingly enough, over that 12-year period, it was unknown the types of collagen that were produced once Bellafill is injected into the skin. A study that was recently completed and has just been accepted for publication into the Journal of Dermatologic Surgery by Dr. David Goldberg, a dermatologist out of New Jersey, sought to answer that question. So patient volunteers were injected with Bellafill intradermally in the post-auricular region, and then over a time course, those injections were biopsied out to 6 months, and then stained with antibodies towards type 1 or type 3 collagen. The first slides that I'll show you here, on the left, you see 1 week post-injection. On the right-hand side, 6 months post-injection. These are hematoxilin and eosin stains. which basically show a couple of things. The way that I like to describe the biostimulatory activity, really, of any biostimulating dermal filler is that it causes an enclosed wound. So you don't have a cut, you're injecting the material into the skin, but it causes a low-grade inflammatory response, which you can see in the purple stain here in and around the clear circles, which are representative of the polymethyl methacrylate microspheres. But over time, you see that you have a tissue that is growing in and amongst those microspheres and encapsulating them. This work actually is a repeat of work that was done historically by the inventor of this material, Dr. Gottfried Limperle, where he showed that the polymethyl methacrylate beads actually last for a fairly long time in the skin. So we wanted to try and understand and characterize the type of extracellular matrix that is produced. So that is the steps that Dr. David Goldberg went through in what I'm showing you here. So what you see are tissue sections from biopsies taken at 1 week all the way out to 6 months at the 1, 2, 3 month intervals. And these stains, or sections rather, have been stained with an antibody to type III collagen. So everywhere that you see an intense brown stain, that represents the expression and the production of type III collagen. I think you can appreciate that at 1 week, there's very little brown staining. Progressively gets more intense at 1 month, but at 2 months, it's at the height of its staining that then wanes over 3 and 6 months. What this tells us is that the process that is occurring, the biostimulatory process that is occurring, is very much like a normal type of wound healing response, because collagen is known to be a wound healing type collagen that is expressed very early on, and then as it is replaced with mature type 1 collagen, begins to wane. So this is a very normal response that one would expect with a biostimulatory dermal filler. Type 1 collagen, on the other hand, is a little bit different, and you can see two things. One is a progressive intensity in staining over the entire time course, maxing out, at least in our time course here, at 6 months. But you also begin to see at 3 months, and then more intensely at 6 months, an ingrowth of what I would call mature bundles of type 1 collagen fibers. Another thing that I would like to point out is that this is not histologically a scar, in that you have a high number of cells, highly vascularized tissue with type 1 collagen fibers coursing throughout. So it's the stimulation of these types of collagen that give the prolonged volume that Bellafill is known to give in type 3 and type 1 collagen. It's just showing that to you in a higher magnification here, and it allows you to appreciate even in greater detail the fibrillar nature at 6 months of the mature type 1 collagen that's produced. So in graphical form, what this means is, as I said earlier, once you inject Bellafill into the skin, what you see is the immediate effect due to the volume of product that's been injected. As the bovine collagen dissipates over time, usually within the first few months, we see an upregulation of type III collagen that is peaked at month 2 and wanes out to month 6. And in contrast to that, a progressive increase in type 1 collagen over time, which is more of a mature dermal type 1 collagen. So now what I'm going to do is to speak about the safety of this product. One of the benefits of having a dermal filler like Bellafill, which has been on the market for now 12 years, is you have a rich history of its safety. And there's been some misperceptions in the marketplace as it relates to its safety profile. And when I first started working with Suneva as a consultant, I wanted to understand the safety of Bellafill myself, and so I asked to see their internal safety data, which is called post-market surveillance. The FDA regulates any company who markets a drug or device to understand the most it can about the safety of its device or drug in the marketplace. And there are ways to understand that through adverse events reports that come spontaneously into the company from providers such as yourself or from patients. We also scan the literature on a quarterly or an annual basis to understand if there have been any reports of serious adverse events in the literature. And so you can collect all of that information, and it provides you for a real-world example of how the product is performing in the hands of physicians and other providers. I asked, when I saw this data, it was very impressive to me, and so I asked that Suneva begin showing this to healthcare providers in various forums, and so this is one of those forums today that I'll speak to. But before I get to that, I want to talk about 2 FDA clinical studies, and importantly to show you that in those studies where patients are followed in FDA clinical trials, Bellafill has the highest number of patients that have been studied compared to the other dermal fillers that are approved in the U.S. and on the market today. And more importantly, when you look at the time in which those patients have been followed, most importantly because of the nasolabial fold post-approval study, where 1,000 patients were followed for up to 5 years, you multiply those number of patients in total by the amount of time that they have been followed, and you can see that the number of patient years that have been studied with Bellafill far outweighs the other fillers on the market today. The first one that I will talk about is the nasolabial fold 5-year post-approval study. This was conducted in 23 centers looking at 1,008 subjects over a period of 5 years. It is the largest and the longest prospective dermal filler study that's been published to date. Sculptra or polylactic acid will be coming out with their study very soon, but it's not yet published, so Bellafill fits this category alone. And the objectives were really to understand how this product behaves from an efficacy standpoint, but more importantly, in a safety standpoint. The data were quite remarkable because in any FDA-level clinical study, it's very difficult to get patients back in for follow-up, especially out at 5 years. Suneva was very pleased to see that 87% of the patients that were originally enrolled in the trial showed up, and of those 87%, 83 had a very high satisfaction rate at 5 years. Now, the 5-year treatment-related adverse event rate of 11.7% deserves a little bit of explanation. In any FDA-level clinical study, the patients over those courses of 5 years are asked to report anything that happens to them that may or may not be related to the actual treatment. So this would include some typical type of dermal filler treatment adverse events such as pain and redness and swelling and bruising. It would also include things like granuloma and necrosis, but in addition to that, could include anything that may happen to them, such as flu or sinus infection or breaking an arm. So in the FDA studies, you typically will see that adverse event rates are highly reported from a percentage basis. And I would advise you, if you have a question about this, to go look at any instructions for use with a dermal filler, any dermal filler on the market today, and look at their bruising rates. And you'll see that those bruising rates are actually quite high. And that's due to this enhanced sensitivity of an FDA-level clinical study. In addition, the granuloma rate in this particular group was seen to be 1.7%. One thing that's very important to understand, I think we've learned a lot about granulomas as it relates to dermal filler treatments throughout the history of dermal fillers in the U.S. We all know that aseptic treatment is of utmost importance to prevent the transmission of any biofilms or any other types of bacteria across the skin barrier and into the dermis. And we've learned a lot about how to treat them. What we do know from the patients that were reported to have granulomas in this study is that 88% of those were resolved at the time of study closure, and the remainder of them went on to resolve with treatment. We also, Suneva also has approval for Bellafill in rolling distensible facial acne scars. This was a study that occurred in 10 sites across the USA. It was in a number of patients that both the patient and the treating investigator were blinded as to whether they received saline injection or Bellafill, saline being the control. We had a primary effectiveness at 6 months, and safety was rated as well as effectiveness at 12 months. And I'm specifically going to talk about the safety because the FDA was very interested in this particular study due to the fact that rather than a subdermal or subcutaneous injection, treatment of acne scars is truly an intradermal procedure where you're going through a modified subcision, injecting fine linear threads of material. And because it was in that dermal compartment, they were interested in what they call adverse events of special interest, that being hyper or hypopigmentation, keloid and hypertrophic scarring, and of course, granulomas. And it's nice to say that in this study, out to 12 months, none of those adverse events were reported. So now what I'm going to do is to switch to the post-market surveillance data that has been collected by the company over the past 12 years up through December of 2018. Over that time course, over 750,000 syringes have been distributed. That is what the blue graph represents there, the year-over-year distribution of syringes into the marketplace. And the gray line at the very bottom is the percentage of adverse events that are reported into the company year over year. I'm very proud to say that Suneva is willing to show this data, because most companies are unwilling to sort of pull the curtain back and let you see post-market surveillance data. But what it shows you is that Bellafill has a year-over-year adverse event rate of 0.12%, and that's consistently across the board. Now, you may have some questions about what types of adverse events that represents. What this stacked bar graph represents is something that typically happens with any product that's introduced into the market, and that is notice the growth of the red bar in the center year over year, and those are the injections that occurred in off-label areas. So any area that is not an acne scar or a nasolabial fold would be included in that. And as you know, as you get comfort with a particular area, or you have a desire to investigate the use of any product into a new area, meaning off-label, that you may run into some types of adverse events that happen. One thing that we learned as it relates to all adverse events that are reported from an off-label nature is that over 50% of those happen in the periocular region, or most commonly known as the tear trough. We believe this is for one of two main causes. One is that this is a very thin-skinned area immediately below the eye, and that the concentric movement of the periocular muscles are causing a clumping over time of the material, not unlike that seen in the lips, body of the lip, with these particulate base fillers. So one thing that's very important is once this information was known to the company, they are discouraging the use of this particular area with Bellafill, and are in fact in negotiations with the FDA to include it as a contraindication. So what have we learned about adverse events with this product? Well, one thing that's very important, as lumps and bumps tend to be one of the highest percentage of reported adverse events, this is a product that's injected slightly different from hyaluronic acids. Linear threads in a retrograde manner are very important, and I would even go so far as to say very fine linear threads, meaning low volumes per pass, in an effort to spread evenly and distribute evenly the microspheres within the tissue. Areas of high concentric or dynamic movement are areas that are not optimal for this particular product. As I said earlier, lips are actually contraindicated in the instructions for use. Periocular area is definitely not recommended. Again, that's an off-label area. The overall adverse events are comparable to other dermal fillers that are on the market today. If you look at granuloma or other inflammatory events, even though they are rare, we have found that they are on par with even hyaluronic acid rates of granulomas that have been reported in the literature. Of course, patient selection is important. Skin prep and treating this procedure with respect, maintaining an aseptic injection technique is absolutely important, as well as the fine linear threads that I discussed just a moment ago. So over time, we know this is the most studied dermal filler on the market. It does demonstrate low adverse events rates, and if you look at the post-market surveillance data, it even shows a consistently low 0.12% year over year over the past 12 years that this product has been on the market. So with that, I will hand it over to our moderator and address any questions that there may be.
Perfect. Thank you, Dr. Pilcher, and thank you, Andy, as well, for the beginning of the presentation. If you do have a question, now is the time. You can put it in the chat box. If not, you can see there we've provided some contact information, info@medresultsnetwork.com, and that'll go directly to us here at MedResults. And we'd be happy to either A, put you in touch with Andy or Dr. Pilcher, or we can certainly help you out individually. But as I look, it doesn't look like we have any live questions today, so I will stay tuned for the survey results. Remember, that will pop up about 30 seconds after the presentation closes. And once again, we just want to thank you both for joining us today. Andy, Dr. Pilcher, the presentation was exceptionally informational and educational. And thank you all to our attendees who were here live today. We look forward to you joining us for our next webinar presentation on February 7th.